soda song. Interesting. That is our phone number, 800-222-5222. It's Midday Live. Dr. Drew, Mike Catherwood, Talk Radio 790 KABC. At the top of the hour, we were going to bring in Professor Matt Swilinski, professor of philosophy at University of San Diego, to talk about this study being done in Oakland where they're giving families a, quote, living wage. Right now, however, we're going to welcome Jeff Stier. He's Director, National Center for Public Policy Research, regarding Philadelphia's soda tax. Jeff, welcome to the program.
Good to be back with you.
So what do you think of this? Is this more nanny state micromanagement, or is this going to have a substantive effect on the health of the city?
Well, it's really an unusual soda tax. It's not just a soda tax. It's a tax on sugary beverage, and it's a tax on non-sugary beverages. Even diet sodas are being taxed, and diet iced teas are being taxed. And it's a really unique case, but Politico is reporting that the strategists in favor of soda taxes around the country are using the Philadelphia case as a lead case as a model for other soda taxes around the country. See, we've heard of soda taxes before, but we don't have any in any major cities. The only city that has one now is Berkeley, California, and I've heard that's an outlier. I'm from New York, but I've heard Berkeley is an outlier.
How's it work? Yeah, right. How's it working for them? Is there any effect? Are they studying what it's actually accomplishing, if anything?
Well, in Berkeley, it's hard to study much of anything. But around the world, there have been examples, especially in Latin American countries, and the advocates in favor of soda taxes have been studying it quite carefully, and they have been very careful to distort the results. See, what happens is when there's a soda tax, and I'm a conservative, I'm a free market guy, I know that taxes have effects. And if you're taxed, you're going to do less of it.
Yeah.
So people are, in fact, buying less soda. But what they're doing is they're substituting their soda for other sugary beverages. They're making their own iced tea, for example, or lemonades, and adding sugar itself.
Or buying, candy bars, or drinking alcohol, or who the hell knows?
Exactly. Well, actually, they do know. The caloric intake has, by and large, stayed the same in the countries where there are soda taxes. But what the advocates in favor of soda taxes have been doing is saying that soda consumption went down. You see, it works. Well, it works. If that's your goal, maybe it works. My goal as a public health guy is, and yes, I'm a free market conservative public health advocate, is that we want endpoints, certain endpoints. So we want less obesity, we want lower diabetes rates, all of that. And the studies that they've been doing have shown that it does not have that effect. But what's worse, the Philadelphia soda tax also taxes diet sodas. So,
what is that all about? What's just unfair to tax just sugary sodas?
Well, what the Philadelphia mayor actually acknowledged at the end of the debate, right before it passed last week, was it's not a public health measure. He conceded that. It's about raising revenue for things like universal pre-K. Now, if you're in favor of universal pre-K, that's great. Government paid. But this is a tax. It's funny because it's a tax. It's not funny. It's sad. It's a tax on those who can least afford it. If you're wealthy, not a big deal. You could pay your 25 cents over your $1 charge, and not a big deal. But if you're poor and you drink soda or diet iced tea, it's a tax on poor people. It's a disproportionate tax, which is strange because these regressive taxes are things that the left is usually against. But apparently it's gotten to the point where the left is simply in favor of these money grabs, regardless of who it hurts most.
Well, but they're sort of, it's kind of a weird paternalism. It's like, well, these poor people don't know how to manage their diet, so we're going to have to create, forces, consequences for their choices, so exactly. We can teach them how to eat properly. Of course, it's not going to work.
Except it doesn't, because if I were counseling someone who's obese, I would say you may want to limit your soda consumption, and if you can't just switch to water, maybe have some Diet Coke or diet soda instead once in a while, which at least has fewer calories and is not associated with diabetes. So the idea of taxing and equally taxing Coke and Diet Coke together equally is absolutely backwards from a public health perspective. It's just like the raging debate over e-cigarettes. Cigarette smoking is very dangerous, a lot more dangerous than a sugary soda. Now e-cigarettes come along, and the government wants to tax e-cigarettes equally to regular cigarettes, which is backwards because you want to encourage people to quit smoking and switch to e-cigarettes. Similarly, you want to encourage people to drink less soda, full sugary soda, and maybe they'll switch to diet soda.
Why do you think? Why do you think there's such a weird thing about the e-cigarettes? People have this weird negative. I've seen it really work for people getting off cigarettes, and as a physician, I mean, I don't know if there's yet downsides. There are other studies need to be done, but it appears to be far better than smoking cigarettes.
The evidence is overwhelming, and the downside is non-existent if you're a smoker.
But what's the problem? Why are people? Why is there this weird energy against the e-cigarettes?
Well, one big reason is because while cigarette smokers have become addicted to the nicotine and continue to smoke, the governments have become addicted to the tax revenue from the cigarettes, which is why the soda tax is such a bad idea. Because why would we want governments around the country, city, state, and federal governments, to become addicted to soda taxes? And then essentially they would be discouraging people from drinking too much soda. You want people to quit smoking, you want people to drink less soda. Why would you tax them and basically the government's becoming addicted? And when I say addicted, I mean putting it into your future budgets, counting on future revenue from high consumption of soda and diet soda.
I wonder if that's some sort of prescient understanding in the way they've taxed the non-sugar drinks as well. In other words, well, we know we're going to be counting on this, so we better get all sides of it.
Better get them all now.
Oh man.
Yeah.
And
these are sin taxes. All right, these are not sales taxes, which you're already paying. These are sin taxes, and with regard to the soda and the sugary versus the diet, you would think that the sin tax ought to be in line with the level of the so-called sin. If drinking sugary soda is a sin, then any tax, if any, on the diet soda should be less or non-existent, or maybe it should be subsidized because you want to encourage people to switch. Same debate playing out with e-cigarettes.
Yeah, it's a complex issue. Do you think they are the reason, or do they claim at least that the reason that they're taxing the diet sodas as well is that there's some data that doesn't work very well for moderating diet?
Well, the reason they're taxing diet soda, and the mayor of Philadelphia pretty much conceded this, is that this is not, because whenever you try to argue the science with them, they've lost and lost and lost, except in Berkeley. Now they're saying, you know what, we can't defend this as a public health measure. It is an effort, in their words, to raise revenue.
Oh,
so
they're flat out.
Why not tax diet soda too?
Oh, so they're flat out saying this is just a way to get money, period.
And if it helps, if it helps public health, then all the better. But the main thing is this is about money.
And now New York tried this as well, right?
Well, under Mayor Bloomberg in New York, they tried to ban large sodas.
Right.
Which basically was a convoluted tax because you could still buy 2 large sodas; they'd just be more expensive. So that failed. People were against it. And the courts ruled against it because they went about it the wrong way. They didn't go through the city council. They just did the public health agency in New York just passed it on its own. And it failed in the courts, not because it was a bad idea, but because it wasn't done in the right procedural way. It was a bad idea, though. Speaking
to Jeff Stier, the director for National Center for Public Policy Research, take a couple calls here. Michelle, question.
Hey, I know you guys are talking about the soda tax, but you had mentioned not understanding why people are against the e-cigarette.
Yeah.
Originally, I wasn't, and I thought it would be awesome to help people get off of smoking and off the cigarettes.
Yeah.
But now I feel like there's so many people that have just literally switched from the cigarettes to the vaping, to the e-cigarettes, and you can adjust however much tobacco and nicotine you want to come out of it.
But
so
Michelle,
I feel like just because they smell good, people are blowing them all over.
Michelle.
Yeah.
The difference between smoking cigarettes regularly and smoking e-cigarette regularly, vastly different. Way worse. No matter how much nicotine you put in the vape, no matter how often you do it, the cigarette, tobacco, is what causes the damage, not nicotine. Jeff, you agree?
That's right. But Michelle raises 2 important points. Number one is that people switch, and are they changing their health effects? And as you pointed out, yes, they are. Second is the idea between nicotine and tobacco, which often get conflated. We're against nicotine because we usually get our nicotine from combustible tobacco. Now we found a way, through free markets, by the way, innovation and profit motive, to get nicotine in a dramatically less harmful way. And the nicotine is not the problem. Very much.
And by the way, Michelle, I routinely have people get addicted to nicotine gum and nicotine lozenges, and that's fine. If you start smoking out of the age of 15, you're probably not going to be able to stop the nicotine. That's the way that's what the brain research suggests. So people just chew the gum.
By the way, ample and conclusive scientific proof of the health benefits of nicotine.
Yeah. So Michelle,
in the absence of cigarettes.
Yeah. So Michelle, it's about the tobacco, not the nicotine. You got it?
Okay, that's fine. Then I was completely misinformed.
Yeah.
I was just...
But Michelle, I will support you on this. You look stupid as hell.
What?
Vaping?
Oh, vaping.
Yeah. At least cigarettes. Cigarettes disgusting and it'll kill you, but you look sweet. You vape. You walk around vaping, you look like a douchebag.
Thanks, Michelle.
Thank you, guys.
Bye. Well,
Thanks,
Mike,
Michelle.
maybe you're just old-fashioned, dude. You're just
Listen to me. You telling me Cool Hand Luke would have been the same thing if he was sitting there pulling on a bright blue light bulb or whatever?
All right, Jeff. Well, listen, this is really interesting stuff, and I wish people, there's so many issues about obesity that are just not politically expedient, I guess. You don't like to address, for instance, one of the pieces of data about obesity is the epidemic really started to bloom when mothers entered the workforce. Now, I'm not saying mothers shouldn't be in the workforce, but I'm thinking, well, there's something there that we ought to be addressing. I don't know what it is, but something there, right, Jeff?
Yep, and the only way we can tackle these issues is by looking at the actual science, looking at the societal issues that you point out.
Yeah, don't worry about the politics. And particularly don't, if there are things to be done that, that the state can do to increase forces that really will make a difference, and by all means. But I'm not sure... we'll see. Let's study it. Listen, good on you, Philly, for trying something, but I just don't think it's going to work. All right, Jeff, thanks so much for calling. Appreciate it.
Always a pleasure.
All right, National Center for Public Policy Research, Jeff Stier.